What if your health plan isn't just expensive, but it's inefficient by design? What if the biggest reason your costs keep rising has nothing to do with the health of your employees, but everything to do with how healthcare is getting delivered to your employees? In this video, I'm going to show you how to build a healthcare supply chain that actually works. One that delivers better care to your employees, cuts out the waste, and finally gives you control over your second biggest people expense after payroll. I'm going to break down the 4 building blocks of every high-performing health plan and show you exactly where traditional plans go wrong. I'm going to point out where the profit leaks happen and how you can fix them, just like we've done for other mid-size employers that have been stuck in the same rigged system. Look, if you run a manufacturing business, a construction, or a logistics business, you know the importance of a well-built supply chain. You've likely got suppliers, shipping schedules, QA checkpoints, vendor scorecards. You're likely tracking every penny from raw material to finished product. But why do we do this? Well, because any inefficiency or any hidden markup or even a delay is going to erode your margin. But when it comes to your group health plan, most employers don't even realize that they have a supply chain. And the ones that do, well, it's usually invisible, bloated, or just completely controlled by vendors who have zero accountability. Your carrier, they're acting as the manufacturer, the wholesaler, the shipper, and the retailer, all rolled into one. And your broker, they're getting paid just to keep the conveyor belt running, not to rebuild it. You end up overpaying for routine services like prescription drugs and other care. You can't trace where your dollars are actually going, and your employees are growing frustrated because they keep having to pay more just to use the health insurance that they have when they need the care. And every year that spreadsheet comes back with the same tired story. This is the best we can do, or this is what the market's saying, or it's just a trend increase. In our video on the hidden costs of misaligned vendor incentives, we pointed out how each player, your PBM, your carrier, even your broker, they profit more when your costs go up. This isn't just bad luck, it's a supply chain that's designed to bleed you dry. Now imagine trying to run your business with a supply chain like that. One where there's no transparency, no control, no accountability. You'd likely be out of business pretty quick. So why accept this from your health plan? Just like physical products move through a traditional supply chain from manufacturer to distributor to customer, healthcare moves through one too, from provider to network to claims administrator to employee. Every step in this process adds a cost. Every handoff is a chance for margin to leak or value to be created. And just like in operations, if you don't know who's doing what or how well they're doing it, you're not managing the supply chain, you're flying blind. When we help employers rebuild their health plans from the ground up, we focus on 4 core building blocks. These are the pieces that every health plan needs, whether you're self-funded, level funded, or somewhere in between. Let's break them down. So for the 4 core building blocks, number 1, sourcing. Who's supplying the care? I like to think of it this way. The cost of care is directly correlated to your premiums. The cost of care is the input in the supply chain, the premiums are your output. In a traditional supply chain, you don't buy parts from just anyone. You're going to vet your suppliers for quality, cost, and reliability. Your health plan should be no different. If you're only using a national carrier network, you're going to be stuck with bloated contracts, facility fees, and zero leverage. Smart employers are starting to direct contract with local providers, surgery centers, and even centers of excellence. They're sourcing care the same way that they'd source any other material. Get better vendors, better prices, you end up with better outcomes. You don't need a narrow network to solve this problem, you need a high-performing one. Second part of the supply chain is financing. Who's bearing the risk? In business, you're not going to take on risk blindly. You want to structure your deals, cap your exposure, you hedge. But fully insured plans, all they're really doing is shifting all the control to the carrier and just calling it safe. It's not risk management, that's just outsourcing your future. If you're self-funded or level funded, you have options. Stop-loss insurance, group medical captives, risk pooling strategies. But these only work if the contracts are written in your favor, not your carrier's. Smart funding equals smart leverage. Number 3, third building block of the supply chain. Who's running the plan? This is where most plans really get it wrong. Your TPA and your PBM are the back office of your health plan. So there's a lot of companies out there that are going to be self-funded and they're going to be with a TPA that's probably not too far off from their carrier. So, if your TPA dictates who your PBM is, then you're in the wrong relationship. Look, this is where you need the most visibility because they're the ones that are touching the money, managing the claims, and controlling the data. But here's the hard truth. Most employers never even question them. They assume that everything's working until costs start climbing, and then nobody can explain why. This is like letting your supplier pick your shipping provider and then being shocked when your freight costs spike and your tracking numbers no longer work. You need administrative partners who are going to be transparent with reporting, flexible with integrations, willing to be audited, and aligned in how they're compensated. Look, if your PBM won't show you the rebates or your TPA charges you extra just to hand over your own claims data, you've got a vendor problem, not an admin problem. And if you're not sure whether that's happening, you probably don't have the visibility that you think you do. The fourth and final, and I would say critical piece to the supply chain is management. Who's going to be watching the store? Even the best supply chain will fall apart without oversight. It's not enough just to build a high-performing health plan. You have to manage it. Most brokers only show up once a year with a spreadsheet and a smile, maybe a renewal letter, and maybe a few options that all probably cost more and cover less. It's not a strategy, that's maintenance, and usually from someone who gets paid more when your costs go up. You need someone owning outcomes. This means tracking the performance of every vendor in your supply chain. Is your PBM delivering the rebate guarantees that they promised? Is your TPA adjudicating claims accurately and on time? Is your stop-loss carrier supporting you or stonewalling you when it matters the most? None of this happens by accident. It takes a solid game plan. You need reviews, data, scorecards, just like you'd manage a logistics vendor, a material supplier, or a subcontractor. Someone's got to be accountable. It's exactly why we created the Benefit Cost Containment Blueprint. It's our framework for helping employers build, manage, and continuously improve their health plan supply chain. No more guessing, no more reactive renewals, just a clear process with clear accountability. If no one's tracking the results, you're not managing a plan, you're funding a black box and hoping for the best. You don't need to tear down your whole plan overnight. Start by mapping out your current supply chain. Ask yourself, where are we sourcing our care? Who are we transferring the risk to? Who's running the administration? And who's guiding the whole thing? Here's an even simpler way to start. Just start with your TPA and your PBM. Make sure that they're actively working to save you money, not just actively spending it. And then if you don't know the answer to number one, start with the last link of the supply chain. Who's guiding the whole thing? Who's watching the henhouse? Strongly consider hiring a new manager or broker who understands how to structure and steward a modern supply chain for healthcare. That's the power of the Benefit Cost Containment Blueprint. It's not just about cutting costs. It's about building a plan that you can actually manage. We've helped mid-sized employers cut 6 figures in waste without cutting their benefits, just by rebuilding the supply chain that delivers the care to your people. It's strategic, it's structured, and it scales with your business. You don't have to settle for a health plan that's disjointed, overpriced, and out of your control. When you treat this like a supply chain and you manage it like one, you gain leverage and transparency. And then you can start getting results that are actually measurable. Most plans aren't expensive because your people are unhealthy. They're expensive because of vendors being unaccountable, and no one's managing the system end to end. If you want a clear, actionable way to assess your setup, grab our mid-year health plan review checklist. It's going to be linked in the comments. This is the exact tool that we're using with our clients to uncover waste, reduce their risks, and identify savings opportunities before renewal happens. I'm Rich from BeneSmart. We help mid-sized employers take back control of their purchasing strategies by rebuilding the supply chain with less waste, better outcomes, and total transparency. If you found this video valuable, please subscribe or share it with your CFO or CEO, and let's fix the system together.